The meeting will start in about 4 minutes. The meeting will start in about 3 minutes. The meeting will start in about 2 minutes. The meeting will start in about 1 minute. All right, I have 2 o'clock, so we'll get started. It's good to see those that are joining us live, and we welcome anyone that might watch this on delay. This will be what I believe will be our last news brief like this. We've switched from doing these weekly to doing them bi-weekly, and now the new questions that we get submitted are pretty thin. So it seems like people consider things pretty routine right now. So of course we can always start these back up if there's a demand, or if we have an increase in cases, or if there is another need. As far as our situation update goes, we have had a total of 600 or 959 cases. Now, a total of 1,843 cases in Adair, 1,425 cases in Casey, 1,449 cases in Clinton, 680 cases in Cumberland, 1,207 cases in Greene, 1,972 cases in Macquarie, 6,319 cases in Pulaski, 1,857 cases in Russell, 3,041 cases in Taylor, 2,195 cases in Wayne, for a district total of 21,988 cases. And that represents about 10.53% of our district's total population has been a confirmed case so far. We currently have 141 active cases in our district. Of those, 15 are hospitalized and 126 on home isolations. We've had a total of 423 related COVID-19 deaths so far. About 423 deaths is deaths among known cases, so that represents a mortality rate of 1.92% for our district, or about 1 in 52 of folks who have been a confirmed case, which is high compared to the state and the national average. Our district mortality rate again is 1.92. The state average is 1.46, and the national average is 1.78. So our local mortality rate is higher than that of the state or the national average. Our hospitalization rate also remains high when compared to the state average. I don't have the national average, but we have a 5.58% hospitalization rate, about 1 out of every 18 cases. So the 5.58% hospitalization rate we have compares to the 4.93% hospitalization rate at the state level. So that's kind of where we are with that. Let's see if there's anything else I want to say about that. Our active cases each week, we'll have a week where we're a little higher than the week before, and then we'll have a week where we were a little lower than the week before. So we're kind of plateaued right now. The last couple of days have been a little higher. I hope that's not a sign of us being on the front end of some upward trend. We'll keep our fingers crossed that that's not the case. The State Department for Public Health started posting on their website a vaccination dashboard. Up until that dashboard was posted, all of the other tracking mechanisms we had was tracking vaccinations by location where the vaccination was given, as opposed to tracking it by residence of the person who was vaccinated. Now, the website that the state dashboard is pulling from is the federal website that uses a system called Tiberius. Anyway, it's supposed to be tracking it by the residents of the people who are vaccinated. For our state, we have had 41%, according to that tracker, of Kentuckians have had at least one dose of the vaccine. This was as of yesterday. And all of our counties in our district were below the state average. Taylor had the best uptake so far of 33.23%, Pulaski 31.72%, Russell 30.88%, Greene 27.89%, Cumberland 26.98%, Adair 25.06%, Wayne 25.04%, Casey 22.67%, Clinton 21.92%, and McQuarrie 19.93%. And that listed McQuarrie as one of the bottom 5 counties in the state as far as vaccine uptake. So that's not what we're looking for. I'm gonna show you all on the screen here the state dashboard so you can see what I'm getting my data from. You should be seeing that now. Are you seeing that, Dr. Wayman?
Yes.
Okay. So you can see that the total population of the state, 41%, and then you can look at it by county. McQuarrie, having had at least one dose, you can see there, I can't hover, 19.93%, or rounds up to 20%, which is what's reflected down here. It shows the bottom 5 counties. It's interesting, what is referred to as the Golden Triangle in Kentucky, which is from Jefferson, Louisville, over to Fayette, Lexington, and then up to northern Kentucky, which is right next to Cincinnati. That's the most affluent part of the state. Now, there are some poor counties in there, but but on average, that's the wealthiest part of the state, or the most affluent part of the state. And that also tends to be the part of the state with the best vaccination rates. It's interesting when you look at our district too. Our district kind of follows the same pattern that the counties like Taylor and Pulaski that have our highest property values, highest average family income are the best, better vaccinated counties. And our counties with the least property value, least family income seem to be the lowest vaccinated counties. So I've had I'm sorry for my computer beeping so loud. I can't turn the volume off, or I've now figured out how to turn the volume off of the emails alarming without turning the volume off on everything. I think what we're seeing, just by glancing at it, I've not seen a correlation study or anything about vaccine uptake in Kentucky or in the United States, but I've been the health director here for 20 years, and it's always been that health and wealth correlate, that the wealthier an area is, the better health. And it's been a struggle in that regard. So we come from a poorer area of the state. We're in the bottom of the middle third as far as for our district property values and average household income. I was talking to a reporter this morning about this, and she was asking, how can we overcome that? I don't know. I don't know what to say to my citizens other than, I consider you all just as valuable as anybody, regardless of how much income you have or how well educated you are. The vaccine is readily available. Everyone, regardless of your social status, deserves equal protection from this disease. And there's no reason why you can't go get it. There's plenty of vaccination in our area and plenty of vaccination sites. So I certainly, would regret to see the poorer counties perform not as well. So I certainly hope we all value ourselves and our health enough to feel like we deserve just as much protection as other parts of the state. So it's basically a choice that every individual has to make at this time. The vaccine's available. Everyone's aware of the situation. So please go get your vaccination. Dr. Waymer Stewart, is there anything you want to add as far as updates?
I do.
Sure.
I want to explain why people should take the vaccine. And it's a shame that they're not taking this opportunity to do so. And I'd like to encourage them. And the first reason is obviously for oneself, is to prevent illness, which may not be very severe, but it may be severe and send you to the hospital and even possibly allow you to die. But not only that, if you recover, there may be some long-term consequences, which people don't seem to think about. But, some of the less severe ones are just fatigue for a long time, brain fog. There are some worse ones. You may lose your fingers and toes or limbs, or you may have a weakened heart or a weakened lung capacity. You may never regain your sense of smell and taste. There are people who have not regained a sense of taste. There are increased risk for anxiety and depression post-COVID illness. So it's not a benign flu or cold. There are things that can go wrong down the road. Of course, the second reason is to try and prevent transmission of the disease to your loved ones, because you may have folks who are older or have weakened immune systems, and they could get very severe disease and die. Of course, the other thing is we want to prevent different strains forming, these variants that are coming. The more disease there is in the community, the more replication of the virus is going on, the more likely you're going to get variants. And if you have variants, some of them may actually not be covered by the current vaccine. The variants right now, the ones that are circulating, are covered by the vaccine. So I think people should get the vaccine as soon as possible. You have 3 vaccines that are available, and the health department provides 2 of them. But there are various places in our communities that do it. Now, what are the side effects of these? Well, they're all less than what you would get from the disease itself. And they're not unsimilar, because you get a flu-like syndrome with the disease, and you may get 1 day or 2 days of a flu-like syndrome with any of these vaccines, including the new Johnson & Johnson. So what is it? I mean, you may feel tired, have headaches, muscle aches, fever, and occasionally nausea. You may get a sore arm and with redness and swelling. These are side effects that you can get with any vaccine. And what these side effects actually imply or are caused by is the immune system responding appropriately to the vaccine to make antibodies and various other chemicals that then give you these side effects. So they're not a bad thing. They're just unfortunate that you have to go through it. And of course, the last reason you should get vaccinated is so that we can all go back to normal life and congregate with more than 10 people or 50 people. And there's also a carrot. I don't know, for those that like to go traveling to Europe and various other places, Europe is actually going to let you in for summer holidays, providing you can show proof of vaccine. So that's a good thing. The other good news is that Pfizer, which we do have a few providers of in our district, we are asking for authorization for the use of the vaccine for 12-year-olds and up, and that by September they will be asking for 2 to 12-year-olds. So we will have a vaccine for children very soon, probably in the next few weeks for 12 and up, and then later on in the year for 2 and up.
Yeah. You know, the vaccine wants to survive. And the way that it survives is by finding people to infect.
You mean the virus?
The virus, yeah. What did I say? The vaccine?
Yeah.
The virus wants to survive. And the way it survives is finding new people to infect.
Right.
And, you know, if we've had about 30% of our population in our district on average that's been vaccinated, maybe about 10% that's had it, there's some overlap between who's had it and who's been vaccinated. But let's just say 40% or even 50%. If the herd immunity is 80%, we're still 30% of the population to go. And we're going to achieve that herd immunity one way or the other. I mean, it's either going to happen through people having caught the virus or through people having been vaccinated. And if you will get vaccinated, we will have fewer deaths and we will have fewer hospitalizations by reaching the herd immunity through vaccination, as opposed to through contracting the virus. So, you know, the herd immunity basically just means enough people have a resistance to where the virus has trouble finding a host or a new person to infect. And so anyway, I would certainly rather get to that herd immunity by the route of vaccination than by the route of people having caught the disease, because it will prevent hospitalizations and death. And that's what we'd like to see happen over the next few months for sure. Anything to add to any of that, Stuart, Dr. Lehman?
Sean, not to that particularly, but I just wanted to add, talk about the new minimum requirements that are on the KY COVID-19 website. The minimum requirements have really shortened up now. So physical distancing, the facial coverings, hand washing and sanitizing, ventilation, telework, if you're able to do that, not being in the common areas a lot. And then there was some changes on the temperature and health checks. Events that have 1,000 or fewer people in a single room. So this is going to be your restaurants that we're talking about. That's limited to the lesser of 60% capacity or the maximum number of individuals that permit for the appropriate 6-foot distancing. So you can either do a 60% capacity. If you can't do the distancing at 60%, then you would want to bring that down to whatever capacity would allow for that. If you're in an event with greater than 1,000 people in a single room, then that is limited to 50% or the lesser amount for social distancing. And I believe, if I'm not mistaken, if you're outside, that those things would be a little bit different as far as masking and things like that go. If you're outside and able to space, then you might be able to forego the masks.
All right. We do have some people watching live. And if you have a question to ask, you're welcome to type it in the chat. We'll try to answer it if we can. We have a few questions to go over today. Number one, Pfizer now being opened up to 12 and up. I think you probably already covered that, didn't you, Dr. Wayman? It sounds like that may happen as early as next week. We'll be watching for that. If so, of course, Pfizer requires the really, really cold storage. There are a couple locations in our district that's providing the cold storage, that has the cold storage capacity. Maybe before school lets out, we can find a way to get some doses shipped to those locations and get them divvied out to, maybe the health department and some other providers that want to do some school clinics. So that's something we may work on, depending on how that approval process goes. There was a question, do we know what FEMA is using? I think while we're talking about FEMA, well, no, I don't think that's right. FEMA, the state, there is some federal FEMA, the Federal Emergency Management is doing some what's called pop-up clinics across the state, and maybe some in our area. They're working through emergency management to set some of those up. Do we know what they're using? I don't know. Do you know, Stuart?
No, I don't.
No. There's also the outfit out of, I'm not sure where they're out of. It's the Wild, is it called Wild Health? That's doing some pop-up clinics in the area too. But anyway, there's plenty of vaccine available. What they're trying to do is set up some locations in some parts of the counties that aren't necessarily just right in towns, and so that maybe we can reach some more people that way. But anyway, if get the vaccine. Since the governor has made a point to address the counties with the most and least participation in vaccination with this map, do you have anything you want to say about that? I think I've already covered that. Again, I'll just reemphasize, it's been an issue in public health for the 20 years I've been here, and for years before that communities that are better educated, that have a higher average family income, it seems like wealth and education correlate, and it also seems like wealth and education and health correlates. And I would say to my citizens in Lake Cumberland, you guys are just as important as anybody else in the state. So, don't let's beat the stereotype. Let's show the rest of the state that we're not comfortable being in last place. We want to be in first place. Well, as I said, this disease is going to run its course, and we're either going to reach the herd immunity through being vaccinated or through having a certain percentage of our population who've had the disease. And if we take the disease route, there will be more death and more hospitalizations than going the vaccine route. So, we would really, really like to see our vaccine uptake better because, in my mind, our citizens are just as valuable as anyone else. So take the vaccine.
And we're seeing younger people now being admitted to hospital and having more severe disease.
Yeah, it's interesting. We're not having quite as many deaths now because a lot of the elderly have been vaccinated. But of the deaths we're having, the deaths are still tending to skew toward the elderly, but the hospitalizations are now tending to skew toward the younger. So, being hospitalized is not an easy thing. A lot of people that's in the hospital end up on a ventilator, and of course, there's a large expense that goes with that and a disruption to your life. And so, it would be good if we could avoid as much of that as we could. Question about the mobile van. Do we have any clinics planned? I know we're working immediately with the housing authority in Somerset to identify some locations to take the van to, our mobile clinic. And, we've talked about maybe trying to take our mobile clinic to some community events that unfold, maybe something like Summer's Nights Cruise or some downtown events or whatever might pop up in the coming weeks. I've asked the county judges if they will let us know when those events happen, that we may try to bring our mobile clinic and try to vaccinate people on the spot. And again, we continue to reach out to, industries and churches and just whoever has a group of people that is a significant enough size that it would be worth our while to take our staff and our clinic offsite. So, we're trying. I will say, though, that the vaccine is abundantly available. So, don't wait for us to come to you. Go get it. It's available at lots of places in your community. Most of these places now could work you in very quickly because they have slots open. Vaccine side effects. Dr. Wayman, do you have anything else to say about that, or have you?
I think I've mentioned everything I can think of.
Yeah.
I just want to say that anything you take in life can have a side effect, including the food you eat and the walk you take in the forest in case you get exposed to poison ivy, you'll come out with a problem. So side effects are common in just being alive.
Yeah.
Hopefully they're mild, and they have been with these vaccines.
Dr. Wayman was talking about traveling to Europe. You're from Australia. Of course, I know that's not Europe, but your husband's from England. And you all are going to travel more than a lot of us Kentuckians. A lot of us Kentuckians are either going to go to South Carolina or Florida. Last year, South Carolina and Florida was off limits. Now the recommendation is if you're fully vaccinated, you can travel without having to quarantine when you come back home. So you can go on vacation this year without having to worry about quarantining. And of course, most of our folks are going to go to the Smoky Mountains or Pigeon Forge or Gatlinburg or Myrtle Beach or Destin or somewhere at one of those locations. So whether you're a Europe traveler or a local, fairly local traveler, that's a positive too. Let's see, what else have we got here? I think that's all of the questions. If anybody's got anything they want to put in the chat, again, we anticipate this being the last time we do this live media and public update. We'll continue to do our daily brief. We put that out 5 days a week now. We're not putting it out on Saturday and Sunday. We'll continue to do our daily brief so folks can stay updated through that avenue. And if there becomes a need for us to start doing these public updates again, we can certainly set them up. Excuse me. As we wait to see if anybody types in a question, Stuart, Dr. Wayman, you have any final things you want to add?
No, just like Dr. Wayman said, please go get vaccinated, and the sooner we all get that done, the quicker we'll be able to get back to our normal life. I heard today on the radio, CDC thinks that maybe around July, especially if we have this good vaccine uptake. But It could be a little longer than that. And just remember that if you are a person who's not getting vaccinated, and you don't have a medical reason not to do that, then you are part of the problem and not part of the solution.
Yeah, and I know I talk to people, Stuart, that say, well, things seem to be getting better without me having gotten vaccinated. I'm looking at the numbers and things are trending down. It's trending down in the United States. It's trending down in Kentucky. It's kind of at a low plateau level in Kentucky and in Lake Cumberland. So what's the point in me getting a vaccine? It seemed like things are going along pretty good without me having gotten it. So why fool with it now? Well, again, I just remind everyone that the virus is going to run its course. It'll reach that herd immunity, which there's a significant number of people that remain. We're going to achieve that either through vaccination or through the virus spreading. And I would much rather us achieve it through vaccination, because if we let it run its natural course through the population, there will definitely be more death and more hospitalizations if we go that route, and it'll stretch out longer, because we could vaccinate everyone very quickly. There's plenty of vaccine now. We can get that done in, it's a very short amount of time. If we're letting the virus spread at 30 or 40 or 50 cases a day, we'll still be tinkering with this thing a year from now. So I would rather just get it behind us. So, okay, we have a question in the chat. We so appreciate all that you do. When I want the facts, I turn to the health department. Thank you so much. Well, thank you. That was the Greene County Public Library. We appreciate the positive feedback from a sister public agency there, public library. And I don't see anything else. Stuart, do you want to leave us with an inspirational thought?
Well,
it's the last chance. We're not doing this anymore. You get the last word.
Inspirational, hey, look, I know, and I'm sorry for the people that have lost loved ones to this. That's a terrible thing. And for the rest of us, we have made it through, and people, I think a lot of people came together through this. So there's still a lot of humanity left out there, even though we may not always see that. So,
yeah. Well, we grew up in this area, Stuart, you and I did, and we know we're conservative people and we're stubborn people. And that's good to a large degree in a lot of things, but it can be bad too. And when it comes to this issue, of course, we can't make anybody do anything as far as taking the vaccine, but from a public health perspective, we would certainly like to see less death and less hospitalization as we round this thing out. So, and I agree, there's a lot of good people here. Most of the people in this area are good people that give you the shirt off their back and do anything they could for you, and I respect that. So, any final thought, anybody? It's been good being able to have this venue through these live updates, to be able to answer the media's questions and the public's questions, and we hope this has been of value to our communities. And again, if we need to pick this back up and start doing it again, we will. But our intent, as of this moment, is to sign off and for this to be our last live update. So continue to watch the daily brief. We post it on our website. We put links to it on our social media. With that, I'll say goodbye.